Okay, I think I'm going to start now. So, good evening, everyone. We welcome you to NewsNowNation webinar celebrating World Health Day. World Health Day is celebrated on 7th April every year to mark the anniversary of the founding of WHO in 1948. Sasha Cohen says, follow your dreams, work hard, practice, and persevere. Make sure you eat a variety of foods, get plenty of exercise, and maintain a healthy lifestyle. I'm Ria from News Now Nation, and I'm your host for the evening. I'm very excited to be a part of such a talented group of people. I welcome our audience as well who have joined us at various platforms. We are live on Facebook, YouTube, and LinkedIn. We have a chat box option available here wherein you can request any questions or comments for the panel. News Now Nation is a digital news platform which covers wide array of topics from fashion to lifestyle to politics to technology and of course health. With a special focus on entrepreneurs, we aim to bring most exciting and dynamic entrepreneur stories and their journey on our platform. Connected to the global news network, we focus on the people, the issues, the events, and the trends that drive today's world. We thank our health partner, Mr. Alok Agarwal's brand, Life 100 Pharmacy. Life 100 Pharmacy is a curated online healthcare platform that is trying to simplify healthcare needs in Allahabad. You just need to order for the medicines and it is delivered to your house in no time. It saves you the hassle of going to a chemist and buying medicines. Thank you. We are very thrilled to have you on board with us, and it was a great experience working with you for this event. We are joined today by our esteemed panelists and our very own keynote speakers, Mr. Arvind Varchaswi. He is the Managing Director of Sri Sri Tattva. He is an eminent industrialist, an Ayurveda enthusiast, and a successful entrepreneur. Under his able leadership, Sri Sri Tattva has grown into a prominent player in FMCG and AYUSH space with the brand presence in 53 countries across 6 continents. Mr. Arvind is recognized as top 100 retail minds of India by Asia, Africa, GCC Retail and Shopping Centre. Mr. Amrish Mittal, I'm going to introduce him in a bit later once he's here. So thank you for joining us. Now I'm going to quickly introduce the panelists. I think we don't have Dr. Sadhna here. Is she here? Okay, I'm going to move on to the next. Ms. Paroma Gulati. She has had a very technical background with MTech in high-speed networks and distribution system, but her passion has remained in health and fitness. She is now a certified nutrition counselor and has clients all over the world. Dr. Aditi Jain. She is an MDS having triple specialization in endodontics, periodontics, and oral implantology. She has done extensive work of more than 12 years, having headed the dental department at Jindal Super Speciality Hospital, Bharatpur, and worked at several clinics. Now, she runs her own clinic by the name of Aditi Dental Family Clinic in Ludhiana. Simran Saini, she is a nutritionist and weight loss consultant. She has certification in clinical nutrition from VSCC Institute of Beauty, Health and Sciences. She has been awarded as the most popular nutritionist in Delhi 3 years in a row at celebrity award functions. Dr. Reema Madhyan, in the past 27 years of her journey as a nutritionist, she has worked with thousands of people and helped them to stay healthy to achieve excellence in their life. She has extensive experience in handling therapeutic diets for thyroid, PCOD, diabetes, menopause, pregnancy, gestational diabetes, and post-pregnancy diets. Thank you, all of you. We will have a quick round of introduction by the panelists themselves about their companies, their backgrounds, and their views on World Health Day. So we'll start with Paroma ma'am. Can we start with you, please?
Hi, hello everybody. It is I can't even believe, the good luck I have to sit among such august company. Now, as Ria said, that my background was extremely technical and I'm actually an engineering student, did my MTech, but on the side, nutrition has always been my passion. And after my son was born, I reached, I think, a record of 100 kilos. And that's when the bell started going that I needed to take nutrition very seriously. So I started studying that. I received my certifications and internships and the whole thing. And now I am pursuing in nutrition counseling, which is, of course, giving diet charts and, focusing on the problems the client has, but also it veers a little bit into the body image issues, your mental health along with it, and generally counseling people as in, to how to eat properly and how to maintain a lifestyle as opposed to getting off and on a diet. I won't take too long because I believe there are a lot of panelists here who need to introduce themselves.
Okay, thank you so much. Moving on to Dr. Aditi. Can we hear a few words from you?
Good evening, everyone. It's such an honor to be here right now. As you introduced everybody, it's so nice to be amongst everybody here. So I am Dr. Aditi Jain. I am a dental specialist and I specialize in a lot of things, but my forte is aesthetic dentistry, everything to do with smile design and also oral implantology. By qualification, definitely I am a dental surgeon, who specializes in gum treatments. So generally, gum treatments are gums are not taken care of by people, and they feel that we are going to the dentist and we are going to have pain in the teeth. So that I just specialize in a very different area altogether. It's just it was my qualification. It is also my passion. Now I have my own clinic. I'm running it in Ludhiana. That's that. And today I'm so glad to be here on World Health Day. So great to be here.
Okay, great. Thank you. Reema ma'am, can we hear from you, please?
Thanks so much, Ria. Hi, I'm Reema and I am a nutritionist by profession. I have been practicing since last 27 years now, and I've done my basic qualification from the Delhi University, did my complete nutritional 4 years course, was attached with Gangaram Hospital. I am too much into the technicality of it. So I basically believe that health is something we make a choice every day. Being healthy is a choice that we make every day. And I run my own wellness clinics, which is in Delhi and NCR. And I'm basically on a mission to educate people about nourishing their body, mind, and soul with the power of good food. So that is what I'm doing all these years. And thanks so much with such a lovely panelist we have around here. And I hope we celebrate the World Health Day with a zing that we actually try and educate people to be healthy rather than being only on a weight loss or a weight gain diet. That's it. Yeah.
Great. Simran ma'am, can we hear from you?
Yes, a warm hello to everybody, to all the panelists and all who are a part of organizing this World Health Day program. So we are missed out on my qualifications. Basically, I'm a graduate from the Institute of Health Sciences, Ireland, Dublin, Ria. That is my basic qualification. You missed out on graduation, which is my main qualification. And then
I'm so sorry.
And I did an add-on certification from VLCC. So that is how my introduction should have been put in anyways. And then I have a working experience of almost 14 years in this field of nutrition. Yes, it has been my passion because I think counseling people comes very naturally to me. And then counseling them in the way for their health, how to use food for improving their health and fitness, question on working on the immunity and different clinical disorders is what I specialize in. And we have a lot of success stories running in, which has given us a very beautiful experience in this overall field. And this World Health Day, again, my mission is to continue educating people about how to keep themselves emotionally, physically, fit, all round fit, by using food as the basic medicine for all ailments. Thank you so much for welcoming me.
Thank you so much. And I think Dr. Mittal has joined us. So we welcome you, Dr. Mittal. Dr. Mittal is the chairman of endocrinology and diabetes at Max Healthcare Delhi. He is a thought leader in the medical community. His contribution to endocrinology, particularly diabetes, thyroid disorders, and osteoporosis, is well recognized. His major current areas of research interest include diabetes and the heart, evaluation of new therapies for diabetes, vitamin D nutrition in Indians, and prevention of osteoporosis fractures. So welcome, Dr. Mittal. On this special day of World Health Day, can we just, have a few words from your side? I'm very honored that, you've taken out time for us on this special day. So can we just please hear from you?
Yes, thanks for inviting me. It's a pleasure to be here. It is the World Health Day. It's a time to look back and look inwards and see what we can do about health. The last 2 years have taught us a lot about health and the importance of health. In fact, I will use that example to illustrate what we really mean. Traditionally, disorders are infective or communicable or non-communicable disorders. So when societies are underdeveloped, then the primary problems are communicable disorders. People die of plague, people die of, cholera, a lot of people, malaria, whatever. Those are communicable disorders. Now, as more development happens and as, societies reach the stage of the way Western societies are, Northern Europe is, or the US is, the widely prevalent infectious disorders go down. And you actually people are living longer. There is urbanization, there is change in dietary habits, there is change in physical activity, there is change in sleep patterns, there is change in stress levels. All that combines to produce more of chronic disease. So when I was a medical student, or even a little later during my days, the focus we were always told in India is on communicable disease. इंडिया में इतना थोड़ी ना ये प्रॉब्लम होती है. हमारे यहाँ rheumatic disease, heart disease होती है. अमेरिका में heart attack होते हैं. This was born partly out of ignorance and partly also because it was true actually a little bit. But in the last 30 years or so, there's an exponential increase in non-communicable disorders, of which diabetes, blood pressure, even cancer is non-communicable and very important, different kinds of arthritis, heart disease, and out of which several are directly linked to lifestyle, right? So basically what I'm saying is that ultimately, if we want to reduce the prevalence of these disorders, let me give you an example. At the age of 60, in a city like Delhi, 35 to 40% people have diabetes. Okay. Now, when you have diabetes, I'm using that as an example, then you are more likely to get kidney failure, more likely to get heart attacks, more likely to get blindness, more likely to get amputation, right? All of that stemming from diabetes and say blood pressure. Okay. Now, if on the other hand, you're healthy, if you're looking after your health, if you're getting tested when required, then much of this is preventable. So when we talk of health, we talk of course, overall physical health, feeling good, the parameters being okay, mental health. But we are also looking not just at what the person is feeling at that point or how healthy the person is at that point. We are looking at long-term issues that those people face, which can be prevented by maintaining good health when you're actually healthy. Right? So you can protect yourself from going down the path, rolling down the path of diabetes and heart disease and hypertension if you are careful from the beginning. And even if you've reached the stage of actual disease, if you are careful about your health, then you can reverse much of it. I mean, yesterday I was hosting a program. I host a weekly program on Sunset TV, and yesterday's topic was oral cancer. So I'm like an anchor in that program. I'm talking of cancer. Cancer is not my field at all. But of course, I get experts and we have a conversation. So what is the thing about oral cancer in India? Do you know that almost 90% can be prevented if people didn't have tobacco? Imagine those pictures you see, the government advertises, all those things you have seen in movies and other places, disfigured faces, all fancy, complicated, highly expensive surgeries. वहां तक क्यों जाना है? अगर हेल्थ पे रहोगे तो डिजीज की जरूरत नहीं है ना, डिजीज क्यों होगी? So the importance of health cannot be emphasized. Wellness and health is the key in an evolving society, rapidly developing society like ours. And we cannot afford to neglect this aspect and only become better and better at fancy surgeries, better and better at the latest technology. Yes, but harnessing technology, focusing on this area, investing in this area of maintaining good health will prevent us from so many things. Society and our economy cannot take the burden of all the non-communicable diseases and their outcomes. It cannot. There's no way you'll be able to pay for all the transplants or all the dialysis and it's not possible. So I think that is the key point that I want to make, that health and wellness are actually very, very important. We have moved from the disease model to the health model. Otherwise, our training was only about disease model as doctors. Focus has changed, or at least we need to have both in focus. And that is very, very important that we need to keep that in mind. And last minute, I'll just say something that is about how COVID has taught us so many things. When you read about COVID, all of you watched TV and read everything those days. The major thing, what did it come out? Who were the people who were getting impacted by COVID in terms of falling seriously sick, reaching ICUs, or even losing their life? Who were those people? They were people who had diabetes, who had heart disease, who had blood pressure. They were all those people. Again, the same thing. If those people in populations that are healthy, right, then the impact of COVID is much less. So I'll give you an example. Let's say I told you 35-40% prevalence of diabetes at 60 in Delhi. And you know that in our own data, and we published that, the bulk of people who died in COVID were actually, they have diabetes, right? Now, I'm using diabetes again as an example because it's most familiar to me, but there are other conditions also. So if the prevalence of diabetes in Delhi was 5% instead of 40%, just think of the reduction in impact of an infectious disease. So this was an epidemic of infectious disease, as you say, pandemic, everyone knows that, on the background of non-communicable disease, which made a double hit. And populations that were suffering from chronic preventable disorders largely, they suffered the most. So it's not just that you're preventing chronic disorders, you're also bracing yourself, protecting yourself from future pandemic impacts. And who knows what the future holds. So just to give just a few lines, I mean, I can go on and on about these things, but the fact is that there is a great role of health. As I said, I repeat, instead of treating disease alone, focus in a country like ours, in every country, but in particular in a country like ours, has to be on prevention. Prevention can only happen when you are able to diagnose diseases early, but even before the diagnosis, when you implement health measures, lifestyle measures, appropriate diets, appropriate physical activity, and testing. Some people are test ka to kuch nahi hai. There's no, sab aise hi hai, doctors ka philaya hua jaal hai. But it's absolutely wrong. You must, if you're in that, I mean, there is a criterion for everything. It's not everyone does every test, but definitely if you're an Indian and if you're 30 years old, even if you have no symptoms, please get your blood sugar done. Please get your blood pressure tested. And if the beginnings of any such thing are there, then nip it in the bud at that point itself. So I think that's the message I would like to leave, that if we maintain our health, especially in the younger age, then we can protect ourselves from many adverse outcomes later on, and also we can protect ourselves from future pandemics. That's all I have to say. Thank you so much for inviting me. I can't hear anything.
Hello.
Yes.
Hi,
Please.
am I audible?
Yes, yes.
I'm so sorry. Thank you, Dr. Mittal. I think that was very encouraging, especially what you said, how prevention is really the cure right now, and how we have to really shift from, the disease model to actually treating. So that's really, nice to hear. And we all know that, there is at least one patient in every Indian household who is actually suffering from diabetes. So that is something that we should really learn. So I'm really thankful for your words. It was really, nice listening to you. Moving on to Mr. Arvind, who is the MD of Sri Sri Tattva Group. Sir, can we please hear from you? I mean, what are your views on World Health Day?
Thank you very much, Riya, for having me here. At the outset, it's such a pleasure to be sharing the dais with such erudite people. I did hear from a couple of the panelists as to what they do. It's really very encouraging, and it's really wonderful to be sharing the stage with such a power-packed panel. Dr. Amrish, what he mentioned right now is something that's very relevant, and this is something that what I would also like to support and say that the entire medical system is moving more towards a health care and also a wellness system per se. And I think India per se has championed that over the last more than 5,000 years. We've seen that our system of medicine from India perhaps is the oldest system of medicine that's documented per se. We have the Ayurveda system that's been there for more than 5,000 years, and with texts. And also what's really wonderful is that the methodology in which that how it's actually brought out and given across to the world is so scientific. And we also at present day we also have pharmacology documents to actually prove that the system of medicine has been there from so many years. What does this really see and also tell us is that the last 2 years, we've seen that the entire pandemic has created havoc. We've noticed that it wasn't any one particular system of medicine. Am I audible? Hello?
Yeah.
We've actually seen that there's been no one particular system of medicine that actually had a particular solution to this particular pandemic. We saw all systems of medicine coming together, and what did that really do is that it put the patient on the spotlight. And what's really good for the patient was something that what was thought about, and people really shunned all prejudices that were there on any system of medicine. One particular statistic that what I would like to mention to everybody is that more than 60% of the clinical trials that were actually held here in the country, and that's actually clocked at the CTRI, were from the AYUSH systems. What does this really show is that there's a whole lot of interest in seeing that how one could start living a more natural and also healthy lifestyle. One particular thing that what I would definitely agree upon with Dr. Amrish over here is that we need to realize that every system of medicine has its own strengths. So when it comes to accidental care and critical care, there's nothing to beat allopathy. But when it comes to answers with regards to lifestyle disorders and perhaps answers that what allopathy does not have, that's where the AYUSH systems definitely come. And certainly in terms of treating lifestyle disorders and also attending to one's lifestyle, this is something that what the entire AYUSH system championed. We've seen that even during COVID times from Sri Sri Tattva, we also did a lot of research, and one of our medicines were also repurposed as a COVID-19 medicine for mild to moderate cases. So what does this really showcase? That we're at a time where it's not any one particular system of medicine that would be relevant at a particular time, but to see that what are the solutions that every system of medicine could give across to the diseases and disorders that are prevalent in today's age and lifestyle. Another statistic that what I would like to mention to everybody is that during the pandemic, we really realized the importance of mental health. over the 2 years, we've seen that the most searched word for in the aspect of meditation was Gurudev Sri Sri Ravi Shankarji's meditation, where the keywords were right from top number 1 and also number 3. What does this really signify is that people are really wanting to learn meditation. They're wanting to attend to their mental health and are looking at avenues to see that how they could actually attend to this particular aspect. And that's where India has really given so much to the world. And I feel that this is something that what we really need to give to the world, especially after the pandemic. It's more our responsibility to first own up to whatever our country has given across to us and also share it across with people. Mental health is not to be ignored. And the moment we attend to mental health, a whole lot of lifestyle disorders and also things like what a doctor also mentioned across over here, like diabetes, can be attended to by having a more relaxed mind. A whole lot of disorders like diabetes could also be attributed to stress, where the cortisol levels are also very high. And by attending to one's mental health through meditation, and also one particular thing that I would like to mention here is that the All India Institute of Medical Sciences many years back actually did a particular paper on the Sudarshan Kriya of the art of living, whereby it showed that the entire base cortisol levels of people change the moment that they do the Sudarshan Kriya breathing exercise and also meditate. This is something that what our ancestors have really championed across, and whether it's yoga or meditation, this is, it cuts across any religion barrier or anything. It's something that what we really require in terms of one's own health. So I would really, through this, World Health Day, appeal to everybody that while we look at physical health and physical health parameters, we also need to realize that mental health is also equally important. And when it comes to physical health, we also need to focus on preventive health. How do I stay healthy? How do I ensure that I do not get across to a hospital or where I would actually need critical care at a very young age? We've seen that a whole lot of youngsters are also turning diabetic here, even in India. What does that show? Stress levels are going up, lifestyles are changing, food habits are changing. These are things that what we really need to attend to. And I see a whole lot of nutritionists also here. I feel that this is something that what all of us here together need to champion to ensure that everybody leads a healthy lifestyle. That's the key word that what we need to attend to. So we would need exercise, we would need yoga, we would need meditation, we would need a little bit of Ayurveda there, and also regular checkups like what doctor also mentioned. So we need to see that what system of medicine is relevant to us at that particular point in time. It's no use, fighting across which system of medicine is better. Pandemic has taught us that all systems of medicine are relevant, but it's the timing that matters. So I feel that on this World Health Day, I would request all of us to see that we bring across the aspect of championing health, whether it's both mental and physical in one's life, and attend to what is required to us at that particular point in time. That's very, very important. And I think with these few words, I would leave it across to the panel. And we also see a whole lot of people who've actually championed health in their own lives. I've seen that, there was a particular panelist who mentioned some time back saying that they also attended to their own life and made it as a commitment to lose more weight and stay more healthy. And I think that this particular commitment, if any of us take, I'm sure that we would be able to see it through. So with these few words, I thank you once again for having me here and wishing everybody a very, very happy World Health Day, and let's all stay healthy. Thank you.
Thank you. Thank you so much, sir. I think we have certainly learned a lot from your words and how to really be inspired to be healthy, to exercise, and to lead a healthy lifestyle. And your contribution to your COVID, medicine also is really great. So we really thank you for your presence here. We have all learned a lot. So moving forward, and I would like to hear from the panelists now. So my first question is, how to build a fairer and healthier world. So, Paroma ma'am, any thoughts from you?
Yeah, so I think how to make a fairer and a healthier world was very efficiently and very nicely covered by Dr. Mittal. As in the whole idea of the paradigm shifting to prevention as opposed to the cure is probably the need of the hour. Because I think like in my profession, I see that nutrition and exercise, it is like an afterthought, even still. You know what I mean to say कि जब problem होती है then you start losing weight and then you enroll into a gym and then you start doing your walks, it is still not a part of our lifestyles. I mean, forget our age, like let's go to school. There are so many schools which have PT period as a joke. I mean, it is just a period for the sake of it you have. So you're not even imbibing the importance of physical activity, say at a school level, at a young age, as opposed to other countries. Maybe if you take Australia, where it is done, it is a part of their lifestyle. You know, the way we study, the way we eat our dinner, the way whatever routine we follow through the day, work, eating right, exercising, it is embedded into it, which sadly yet doesn't happen in our country. So before we start making the world healthier and the world fairer, if we look closer to home, I think this idea of nutrition, that you don't need to go all the way to the doctor. Like Dr. Mittal said, that you can just avoid 90% of oral cancer by preventing the intake of tobacco. Similarly, if you start these lifestyle habits at a very early stage, then you don't need to, go through this and do this change when it is already too late. It is not. It is more to do. And when I was introducing myself, this is something I observe very often, that when we speak about the word diet actually means the food you eat. But the word, it's such a, it's a misnomer. When we say diet means a specific amount of time eating a specific amount of food to lose weight. मतलब इंडिया में आप अगर डाइट बोलो, हम डाइट पे है, इसका मतलब है that we want to lose weight, hence we are eating something. But it is not that. It is something which should be like, in a lifestyle. So my point being that before we move on to making the world healthier and making the world fairer, let's start a little bit at home. We have, again, like Mr. Arvind just said, that 5,000 years of history of having, we have the science with us. And I think that we don't utilize it. Before pandemic struck, I don't think a lot of people would even know what is Giloy and Ashwagandha is. But right now, every store you go, there will be an immunity kadha, there will be a Ashwagandha, there will be Giloy, and a whole lot of things which we had from a long time, but none of us really bothered to go check it up. It is available in, stores like Fab India. It's not something exotic or, Mr. Arvind's own, I think they manufacture. I was reading about Sri Tattva. So before we embark on making our world fairer or the world healthier, I think we should start at home. We have the sciences, we have the, the intelligence. It's just the implementation. And again, I think the implementation does not start in your 30s and 40s when your blood report comes the way it shouldn't. It should start at a very early age. The importance of eating right, the importance of meditation, your mental health, in school, things like body shaming. These are words which have probably cropped up of late, but it has been there even when we were young. I was young 40 years ago, but even then we all were, to some extent body shamed. It does impact your mental health at some point of time. So closer to home, I think that the need of the hour is like, we have such eminent panelists here, is to emphasize on the fact that all this begins right from the grassroots level, right from an early age. That's what I feel.
Great. Reema ma'am, what are your thoughts on how to build a fairer and healthier world? You're on mute, ma'am.
Can you hear me now?
Yes, perfect.
So first of all, I would really appreciate all the three panelists. I mean, the inputs given is actually a wholesome of what we are actually talking on for the World Health Day, for the world to be healthy and fairer. But yes, I agree with Paroma completely. It starts at home, and it is something which we should manage, starting with our children, talking about the mental health, talking about lifestyle changes, rather than giving them fast foods, giving them foods which are more healthier in a different package kind of a form, which is freshly cooked. So it's like the effort at the home front, which should be done first, using a lot of Ayurveda, which is from our kitchen shelf. Practically speaking, the Indian ancient Ayurveda is the best, and the Indian thali is the best way to cure or reverse, I would say, any kind of lifestyle issues, be it diabetes, be it even thyroid, PCOS, which has come up like, I mean, almost, I would say 90 to 95% of my clients, specifically girls aging from 13 to the 40-45 age, go through a ruckus of hormonal imbalance. It is only because of the diet, the dietary intake, the lifestyle that they lead in, so which can be really reversed only by inculcating the good eating healthy habits, some kind of an exercise, using the natural herbs which are found in our kitchen shelf, and a good sleeping pattern rather than late nights. So these are 4-5 things, and including some yoga or meditation. If actually people start using these 5 things, which is called a fist, it's like eating right, sleeping on time, having good amount of water intake, doing some of the other exercise and meditating, you will see how the nation, to begin with the house to the nation, becomes healthy. So mainly, I would really want people to go back to their roots and talk about the basil leaves, the tulsi, holy tulsi that we use at home can be used. Ashwagandha, your ginger, turmeric, these are the things which have to be used and inculcated in daily habits. Children should be introduced to these things from the beginning. And once we focus on our children, obviously our generations will become much more healthier. And reversing the lifestyle with changes in the pattern, that is what is needed. That is the need of the hour, I would say. And this can be done only by the health professionals, like one of us, the whole panelist is there, all the doctors, because I believe we are actually the gatekeepers. It's like prevention is better than cure. So we are the gatekeepers. We have to educate people around so that they change their lifestyle and they do not go toward the diseases, and we actually start leading a disease-free life. That is what I would say, how we can make a world which is healthier and more fairer.
That's great to know, and that's really some of good inputs by you. Simran ma'am, I would like to know from you that how has India faced this pandemic, and what were some of the challenges faced by everyone around you in your field?
See, like a lot of discussions have already taken place till now. The various panelists have discussed various issues. And therein, the main thing that we discussed again was that the pandemic got worse because people were already suffering from a lot of lifestyle disorders, which meant it very difficult for them to cope up with the infection they were exposed to. So if they would have been in a better state of health, with a better immunity, with a better eating habit, a better emotional state, then it would have been easier for them to actually face the pandemic and get over it, right? So most of the people who suffered the most were the ones who already had a pre-existing history of some kind of a lifestyle disorder, which got worse during the course of the treatment itself. And we saw fatalities all over. Then moreover, since we have a huge population, getting the resources to everybody was a very difficult job. Now, again, I would say that the positive point, the only positive outcome that I saw was people actually started looking at the concept of immunity, good health, more seriously after this pandemic happened. People realized what is the importance of staying healthy. You know, now if I look at the present generation, now if I look at the present state of people, when the patients, they come and they interact with me, I find that they're already reading a lot about nutrition, they're researching a lot about good health. So people are becoming aware day by day, especially the young generation is also understanding the importance of good health. So people are much more into yoga, much more into workouts, much more into eating healthier. Like I'm quite surprised when youngsters would walk up to my clinic and say, make us a diet where we can eat healthy, we can eat superfoods. I never got that kind of feedback in the last 10 years, but now I get good feedbacks, We want to eat real healthy, you want to eat real good juices, what are the superfoods you can introduce us to? So that is one of the positive outcomes, I would say. The only thing that needs to be done is now, since we are understanding that this is the need of the time, we need to constantly work on it. There is no quick fix to it. There is no 3-month diet that will, improve your health and keep you in the same shape, in the same state of body for the next 30 years. If you want to stay healthy, you need to constantly work on it, which means you always need to eat healthy. You always need to keep working out. So if we do it in continuity, only then it is going to help us. So that is the only thing that I'm trying to make people understand, that improving your lifestyle and working on it is a constant process. Do not take it like a small time sprint. So if you work on it in that manner, I think then we will attain, as all the other panelists have been talking about it, that prevention is better than cure. So we'll be on the preventive health line, just if we keep working on this. And food is basically magic. It's the best medicine in the world. You go around and talk about any of the cultures around the world, any of the medicinal systems around the world, and basically it all started with basic food items. Like she said, it's all there in your kitchen. If you just focus on that, it's going to work like magic on you. You don't need to reach a point where you would need big portions or big treatments to get yourself out of the soup. So just work on that and work through us. We are there to help you. Let's all together, I would say this for all the fitness professionals around the world, whether it's a yoga trainer, whether it's somebody who's running a gym, whether it's a nutritionist, whether it's a doctor. Like I have worked almost for 10 years with the Fortis group of hospitals. So being there as a nutritionist, I worked with so many doctors, and over again, it kept coming back to the same thing, that when the people who were on a particular course of treatment were also on a healthier diet, the treatment worked like magic. The results were faster, the results were permanent, and the people felt better, even in state of mind, because what you eat is also what you think. It's directly linked to each other. If you're not eating good and you're meditating, it will not help. Trust me. You have to eat good and meditate. That is how you can cleanse your body, mind, and soul. It all has to come together, right? So this World Health Day, let's focus on healthy eating, on working out regularly, and keeping ourselves in the best state of health and mind. That is what I would say. And I would again like to thank you for welcoming here on this World Health Summit and taking in my thoughts on this. Thank you.
Thank you. I would, really agree with you, because I'm myself constantly searching, what are the healthy foods to eat, or what new superfood can I, try and include in my diet. So thank you. Dr. Aditi, you are a dental surgeon. So from your perspective, I would like to know that, do you think we have all the resources to be healthy? And what are your views on that?
If we look at the times now, there are really different times that we are facing. Pre-pandemic, there was a time when patients were coming to us and they were just generally thinking that why aren't you prescribing an antibiotic? I have this pain in my throat, and back then if you tell them that it's not good for you, we don't need to give it to you right now, and it's okay. So they wanted a very quick fix to that pain back then, and one of the big differences that I've now realized with all the patients coming in, they're like, no, they have understood the importance of keeping healthy, otherwise letting the pain go on its own at times, and like antibiotic resistance is what I used to speak to my patients about earlier, and now is when I realized that they have read about it, they know a lot about it, because there was so much that was going on during this COVID time that they did come to know a lot more detail, and now they do agree that yes, it's not good for us. So the approach has shifted to a more preventive side. Having said that, when people are adopting a lifestyle change, they must also take care of getting checked regularly, like it has already been spoken by all the other panelists as well, that keeping yourself checked without having that pain or without having a problem is also one of the most important things that we can do for ourselves. It's like prevention. And that during that checkup is when you actually come across maybe something is going wrong, and it can be caught in a very minor stage. So one of the things that I feel is this. And apart from that, about eating healthy, I think a lot has been spoken about that. But I have really noticed one very important change in all the people coming in now after the pandemic. They've understood, see, because nobody speaking from the point of view of a dental surgeon, we were working in the mouth. And, literally patients and us both were like really scared of the fact that, what to do in this COVID situation. And because the patients also did not get a very fair chance of visiting a dentist, or maybe getting themselves checked or whatever it is treated, they started taking better care, because they were like, if I don't have pain and if I can stay healthy, why not do that then compared to going to the doctor with pain or anything. So it's a very good thing that now the practice is shifting from treatment to prevention. But I would also like to mention one thing, that we as practitioners in whatever form must focus on prevention. I mean, sometimes you feel that the patient may not want to hear it, or like the person we're speaking to may just wants a treatment approach. I think a lot of times they are looking for some preventive measure that you can speak to them about and let them know about. And I think we can be instrumental in, giving that health tip that they may be looking for, and making their lives better, our lives better too. And that's that for now. And just stay healthy and stay stress free. I think COVID has given everybody a lot of stress. So there's a relation. Stress has manifestations everywhere. Very rightly, it has been said, that if your eyes are a window to your soul, then your mouth is a mirror to your health. So yes, get yourself checked, and that's what my general say is to everybody, that getting yourself checked, no matter what, like going to a dietitian is preventive. You don't have to go to a dietitian when you are already 150 kgs and thinking about it. You should rather visit when you are thinking that I just want to stay healthy. That's it. I don't want to lose weight. To stay healthy. So that is what I would like to say today. And thank you so much for inviting me here. It's very nice to be here.
Thank you, doctor. So Dr. Sadhna couldn't join us today because she's in the OT. She's a laparoscopic surgeon. So I think her husband has joined, who Air Marshal Prakash Kala. So I know you are also somewhere related to health and stuff. So what are your views on World Health Day today? What is one message you would like to give out?
Firstly, I'm sorry that Professor Kala missed this great opportunity to speak on this show. Her profession is such that she's held up in the operating theater, and she has asked me to speak on her behalf. So essentially, the World Health Day 2022 is about environmental health, and she wanted to speak a bit about that. So just to put a few numbers first, 24% of all global deaths, that is 13.7 million persons every year, die because of environmental causes. and millions more are sick because of environmental causes. And history is that if you think of history, then you know all the farmlands of ancient civilizations are deserts today. And that is the way we are headed if we do not take care of environment. So what is environment? You know, everything external to us is environment. Whether it is biodiversity, whether it is your nature, cities, built up areas, or anything, that is all environment, and it all affects our health. Now, you know, how does environment affect health? In fact, I'm unable to show you a diagram which some of the researchers have put up in a very nice way. But let me just, having said what is environment, everything external to us is environment. If it is cities, so how do cities affect us, for example, our health? Now, if you have built up areas which do not have open spaces, which do not have parks, which don't have greeneries, which do not have walkways, which don't have cycle paths, so we cannot, our physical activity reduces, and that affects our health. That is how the cities affect our health. Now, there's something which we all know. For example, what are the determinants of health, so to speak? Now, let us say air pollution. We all know about air pollution. Everyone knows what, in what way, what health is affected by air pollution. You have respiratory infections, you have stroke, chronic diseases, lung cancer, all due to air pollution. Next is like water pollution, which causes cholera, typhoid, cancer, hormone disruption, and so on. And there are statistics of 2015 that 1 billion people every year are affected by medical conditions or diseases caused by water pollution. We have already talked about built up environment like cities and all that. And I think we heard something about lifestyle on this show also. And lifestyle is something which we can control. Cities and nature, individuals may not have much of control, but certainly lifestyle is something we can control. So what are the effects of lifestyle? Let me just give you some numbers. For example, we can save 66% of deaths. We can reduce deaths by 66%, deaths by cancer. We can reduce death from cardiovascular diseases by 65%. We can reduce diseases by other causes by 57% simply by following a healthy lifestyle. I think everyone here and even the public today is very aware of what healthy lifestyle is. And basically it is have nutritious food, don't abuse environment, don't take drugs, avoid alcohol, and all that. I think we all know about it. The question is, do we all practice it? Well, some of us do, some of us don't. And then finally coming to something which we all know very well, that age, gender to some extent, and heredity. These are other determinants of health. As you age, your risk of suffering injuries, your mental and physical abilities go down. We all know that. There is some different types of diseases for men and women which are more prominent in old age. And heredity, there are certain like cancer of ovary and breast cancer, BRCA1 and 2 genes people have, they have higher risk of suffering that. In fact, Angela Jolie got both her breasts removed because that risk. That doesn't mean that if you are genetically predisposed to get it, you will get it. You may not get it. And people who are not disposed to that may still get it. So now, how do I conclude this? There are things governments can do and should do, and it is citizens' responsibility to persuade them to do it. There's something we as individuals can do. For example, don't subsidize farm. We had a farm laws which have been withdrawn, which were basically to, certain type of farming we were supposed to avoid. Anyway, let me conclude by saying that the famous saying, those who don't learn from history are doomed to relive it. And so, if by 2025, if the, say, global heating because of human activity like greenhouse gas emission, if it doesn't peak by 2055 and then reduce sharply, which it is not going to do, then during this century and next century, we are doomed. Thank you. And I apologize once again for Professor Kala not being here. I'm sure she would have loved to be here and say all this herself. And she speaks far better than I do because she used to speak. Thank you.
Thank you, sir. I think that's a very nice perspective how you brought out environment health also here, as in we have to be really mindful towards our planet. That's also definitely a goal for WHO. So just to conclude, I would just ask all the panelists in one line each, please. What is this one advice you want to give to the public and our viewers on World Health Day? Just like we'll try and keep it as short. So Reema, I'm starting with you.
Okay, the only one advice which I would like to give all the viewers is you have only one body to live in. So respect it, eat well, sleep well, and definitely take care of your mental health, physical health, spiritual health, all over, I would say. That is what I would say. So take care of your body. That is the only place you live in.
Great. Simran ma'am?
Yeah, so my advice would be that good health is a continuous journey. It's not a short time sprint. You have to continuously work on it. And that is the only way you can preserve yourself and keep going in a good state of mind and body. So be on it in a continuous mode. Keep eating healthy, keep working out, keep working on your mental and spiritual health in a continuous mode. The way you brush your teeth every day, just don't forget to do it. The way you breathe all the time, just remember to keep working on your health in a good manner in the same way. That is the best way in which you can reward yourself and have a very fulfilling and happy life. I mean, good health is directly equal to happiness, trust me. So you will experience it.
Dr. Aditi?
I would just like to give one basic advice that, just by, I can understand that a lot of people may not be able to get up early, maybe not be able to eat really healthy foods due to their work commitments or whatsoever. So then if we just introduce, say, brushing twice a day, making sure that I am going to follow up on my checkup rather than treatment protocols is what I'd like to stress on. Go for a checkup if something is pending. You know it, you go for it. I think you can keep yourself really healthy that way. Be it a dental checkup, it could be just any other checkup that you know that is pending. Don't keep things pending. You have one body to live in. So take care of it. You have one set of teeth now. So take care of those too. We are here to provide you the new ones, but they're not as good as these ever. So that's that.
Great. Paroma ma'am, last words from you.
So what I want to say is probably a summation of what everybody said, that your body is your temple. At the end of the day, and I'm talking from very personal experience, your body is something which will stay with you till your last breath. Everybody might come and go, family, all that, but your body will stay with you. So it is your duty to take care of it and give it good food. And I think 1 hour in 24 hours is roughly 5%, 4.8 to 5%. You can take that much out for activity. Yes, we have a very fast lifestyle where, work is more important, our kids are more important, our parents are more important, but we are also that important. I mean, I don't want to be a sexist, but this is very common for women. We like to be the self-sacrificial thing that everything comes first, but no. Our bodies, our mental health, just as important as everybody else. So please take care of it.
Thank you. That was some really nice advice from all the doctors, dietitians, etc. So thank you everyone for joining us for today's webinar. I'm sure we've all learned the tricks of the game and we'll be really inspired to be a little more healthy than we actually are. It has been a super experience interacting with all of you. I thank our esteemed audience as well, most of whom were on YouTube with us. So any comments or feedback are please welcome. And we have many more inspiring and cool stories on our website. And this is a message for all the panelists as well. Anytime you would like to share or want to publish any of your articles, we'll be happy to do that because we really want to create a nice bond and relationship with you. So in the end, I would just like to say, wellness is the complete integration of body, mind, and spirit. The realization that everything we do, think, feel, and believe has an effect on our state of well-being. We had a rather engaging discussion today, and I look forward to many, many more interactions with you in the future. So thanks a lot, everyone. Thank you for joining.
Thank you so much, Ria.
Yes, it was all our pleasure and honor.
Thank you so much.
Thank you. So I'm going to share the YouTube link very shortly with all of you.
Okay, great.
Right. Thank you.
Bye-bye.
Thank you.
Thank you.
Bye-bye.